Most state workers could soon have certain employment protections if they are medical marijuana patients. The Louisiana legislature passed a bill that would outlaw negative consequences for state employees based solely on a positive test for the drug if a doctor recommended it. Paul Murphy reports supporters of the new proposed law see it as a good first step as Louisiana's expanding its medical marijuana program.
Right now, there are more than 43,000 medical marijuana patients in Louisiana. That number has expanded dramatically since the state authorized the smokeable flower version of the drug.
Since the introduction of flower, our business has tripled almost, and it's growing continuously. First of all, flower makes it more available, and it makes it more affordable.
The state legislature is now scrambling to pass new laws to keep up with the growing popularity of the medication. Lawmakers just passed a bill by Representative Mandy Landry from New Orleans that would prohibit state agencies from firing workers who use the drug under a doctor's recommendation. Those employees would also be protected if they test positive on an initial screening for a job.
And we don't have any protections for workers who have a medical marijuana prescription, and it's just kind of up in the air, and each employer treats it differently.
The new law would not apply to certain occupations, including law enforcement and firefighters, as well as other public safety officials.
It doesn't mean you can be high at work at all. The language in the bill is very clear, just like you can't be drunk at work.
Louisiana Progress, a group that has pushed to relax state marijuana laws, helped draft the Landry bill.
As our medical program continues to expand, everybody knows we're going to be dealing with more Louisianans who are part of this program. And so there's just a practical aspect to this that we need to figure these kinds of things out.
Ruston Henry, owner of H&W Medical Marijuana Dispensary in New Orleans, says employers need to recognize medical marijuana is just that, medication.
You wouldn't penalize somebody if they were on anti-anxiety medicine, pain medication, or psychotropic medications. You wouldn't penalize them for that, so why are you penalizing them for being on the medicine of medical marijuana?
The marijuana bill now heads to Governor John Bel Edwards' desk for consideration. Paul Murphy, Eyewitness News.
Representative Mandy Landry told us she hopes to propose legislation in the future to give private sector employees the same medical marijuana protections. The state legislative session ends on Monday.